Maybe the last question, now that we've talked a little bit about science and scientific methods, um, thoughts on how you would or you will evaluate this program? I mean, in many ways, this is a change, and the standard typically in any kind of societal change is to compare it to the status quo, which is traditional medical education as has existed for many, many years. So maybe some thoughts from both of you about, what some of the outcomes would be, what you would be comparing, what time horizon, and not to put you completely on the spot, but maybe just a little brainstorming about, imagine that there's some sponsor out there who really likes this idea and says, this is really cool. If you can show me that, this makes a difference and is a better way to do things with a little bit of scientific evidence, I'll put some money behind it and maybe support the growth of this model.
Yeah, so there are lots of potential different ways of evaluating this. I think your notion of comparing it to the status quo is an easy one. Not that it's easy to do, but it's an easy fallback to say that's what we should do. We are all looking at ways to make medical education less expensive. We're all looking at ways of making medical education more pertinent to the populations for whom the doctors will care. And were we able then to create evaluated measures of those sorts of things, I think that would be a good place to start. That's not my forte, but that's how I would conceptually look at that. And were we able to do something like that? Were we able to measure the community's engagement in embracing medical education as part of what they need to do? I think would also be a very novel but important outcome measure to have. That's where I'd sort of go with it.
Mm-hmm. Yeah. And I think the only thing I would add would be, it is a difficult question because what we're doing is, it's competency-based, experiential, it's very much asynchronous for all of our students and for us. And so trying to nail down assessment is difficult. But I think the most important thing is that our learning is meaningful. And so making sure that whatever we choose or however we choose to do that reflects that belief of ours, is that this learning is meaningful because this is our time to train. This is it. We're going to be training as physicians, and what we learn now, like I mentioned earlier, is not just for us, it's for our future patients, and that's really important.
Yeah. No, and from my perspective, probably a couple other things that one might want to consider, sort of how do the physicians that are involved in the training feel about this program. They had gone through their own training years ago, and they've seen newer clinicians and might even be doing rotations or residencies with clinicians. So maybe getting some of their perspective could be valuable. Maybe the patient perspective as well. And you could think about how we might kind of match patients in traditional care versus some of the ones that you're doing, and think about whether they find it a little bit more humane and pleasant, I guess, to sort of interact with a design partner and a medical student. Well, this has been great. I want to thank you both for joining us, and looking forward to see how this progresses. And I'm sure you're looking forward to starting in 2 months and ultimately being one of these new physicians to help us in the future. So thank you.
Thank you for having us.
Sure.